Millions of tattoos are placed every year, and the vast majority go perfectly well, and you end up with a beautiful piece of body art that'll last you for a lifetime. However, complications do occur, and today we're going to be discussing one in particular, the tattoo allergy. You can become hypersensitive to your tattoo ink. Hi, I'm Dr. Messina, and today you're going to learn all about allergies to tattoos. You're going to learn what the signs and symptoms are, and if you happen to have an allergic reaction to your tattoo, how you could go about treating it. We're also going to touch upon something called the henna tattoo allergy. And finally, I'm going to discuss something that's a hypersensitivity reaction, and it could be very confusing and make you think you have a tattoo allergy, but you don't. I'm going to put that more towards the end. Any ink has the potential to create an allergic situation. Red ink in particular is the most common culprit when it comes to developing a hypersensitivity, because red ink has a substance in it that's very allergenic to many people. When you have an allergy to your tattoo ink, it can occur at several stages. Immediate onset would be while you're sitting in the artist's chair. You might become flushed. You might actually feel faint because you vasodilated and dropped your blood pressure. You could become extremely itchy, develop a rash and/or hives. If any of these things occur as you're getting your tattoo, it's important to stop placing the tattoo at that point and start taking antihistamines and probably steroids, because the immediate hypersensitivity is the most dangerous one. It's the most likely one to cause an anaphylactic reaction, which is a life-threatening allergic reaction where you could get swelling of your airway, cutting off your ability to breathe. You could also drop your blood pressure to critical levels. And that's the type of an allergic reaction that requires an emergency room and stabilization. So if you start developing these symptoms as you're getting the tattoo, stop and get treatment. Fortunately, this anaphylactic reaction is rare. Most of the time, we develop a delayed hypersensitivity, which could occur from days after you get the tattoo to years after you get the tattoo. Most people with hypersensitivities to the tattoo have a much more milder course. They might take a hot shower and notice their tattoos tend to swell and become itchy. They might develop rash occasionally, they might develop hives occasionally, or they might have a redness around the tattoo. Depending on the severity of the symptoms is going to guide how we treat this. Mild symptoms could be treated very conservatively. A little antihistamine should resolve the situation. However, if you have profound urticaria where you're constantly scratching at your tattoos, you run the risk of breaking the skin and the developing of a cellulitis or a skin infection. That can become a significant problem, especially if you have something like diabetes. In that instance, something more has to be done. If you have a significant hypersensitivity to your tattoo, you do not laser it off. I'll repeat it. Do not laser off a tattoo that you have a significant hypersensitivity to. You could run the risk of exposing so much antigen due to the breaking of the ink and the shattering of the dermis that you can have that anaphylactic reaction occur. So what do you do if you have an allergy to your tattoo? Well, you can take antihistamines and/or a course of oral steroids. That might tamper down the hypersensitivity and give you a little relief. It could give prolonged relief. You stop taking these medications and you wait until it occurs again. You can give steroids into the tattoo. I don't recommend that. The administration of steroids into the skin can cause a destruction of the subcutaneous layer, in other words, a fine layer of fat, and you could develop a dent in your tattoo, and that's very unsightly. If it's a significant allergy though, then the tattoo should be surgically excised. Hopefully it's a small enough tattoo where they could just surgically excise it, suture the wound together, you'll have a little scar but you're all done with it. If it's a larger tattoo, they might have to do segments where they'll take a piece off, suture that, wait a few weeks, take another piece off and suture that. An extremely large tattoo with an allergy is more difficult and is probably going to require medical treatment. The henna tattoo is an interesting phenomenon because henna tattoos have been around for thousands of years and they're relatively safe. They're popular because they're easy to put on and temporary. However, recently we've had a bunch of people presenting with allergic reactions to the henna. And when you investigate it, it's actually not the henna itself. It's usually a substance that's been added to the henna, specifically a black henna. And black henna tattoos are very commonly placed at house parties, children's parties, carnivals, things like that. So you have to be very cautious about getting a henna tattoo outside of a professional establishment. A henna tattoo allergy is really not a life-threatening situation. Usually it's self-limiting. Once the henna is gone, so is the allergy. You can get some skin changes, however. Also, if you do have a true henna allergy, it's important to tell your hairstylist because many of your hair dyes have henna in them. So if you happen to be truly allergic to henna, then make sure you tell your hairstylist and you avoid the henna tattoos. Now we're going to touch upon the granuloma formation. Granulomas look almost like tattoo allergies. However, they're raised and they're firm, almost like a red scar. It is a hypersensitivity reaction, but it's not a pure allergic reaction. It could be treated a few different ways. Intralesional steroids, in other words, injecting the granuloma itself, is very popular. However, again, we run the risk of losing the subcutaneous fat. They could also be surgically excised. So it's important to know, do you have an allergic reaction to your tattoo or is this a granuloma formation? We did have a situation a few years ago where ink that was imported from China had a substance in it that caused granulomas. That's all been resolved. I haven't been hearing about it so much anymore. But that was one of the situations that caused these granulomas to form. Well, I hope you learned something in this video about tattoo ink allergies and what you should do if you think you have one.